Welcome to episode 1 of the CyberClinic, the podcast where healthcare meets cybersecurity, AI, and digital transformation. I am your host, Claude Bernard. I am a doctoral student in Health Informatics and cybersecurity advocate. In this first episode, we're tackling a big question. Why has cybersecurity become the new frontline in healthcare? Healthcare is now the most targeted industry for cyber attacks, surpassing even finance. Why? Because health data is incredibly valuable. On the dark web, a complete patient health record can fetch anywhere from $250 to $1,000, compared to just $5 to $10 for a stolen credit card. Health data is rich with personally identifiable information, such as names, social security numbers, insurance details, prescriptions, and even billing history. It's the whole picture. Once stolen, health data can be used for fraud, extraction, or identity theft. Over 100 million patient records were compromised globally in 2023 alone. That's about 270,000 people per day whose privacy, safety, and continuity of care were suddenly at risk. Take the 2020 ransomware attack on Universal Health Services. This massive health system with 400 facilities across the US was hit so hard that staff were locked out of all digital systems. Clinicians had to revert to paper records overnight. Surgeries were postponed, lab results were delayed, and patients in emergency care were diverted to other hospitals. In June 2024, the National Health Lab Service in South Africa's primary public health testing network, suffered a ransomware attack that disrupted lab services nationwide. The attack severed communication between lab systems and medical databases, delaying test results and impacting responses to health crises like the mpox outbreak. The breach also deleted backup systems, complicating recovery efforts. Or the 2021 attack on Ireland's national health system, which paralyzed radiology systems and appointment scheduling across the country for weeks. Even cancer care follow ups were suspended. The government refused to pay the ransom, but the recovery took months and millions of euros. Increasing targeting of healthcare sector. Hospitals have become more appealing targets for ransomware attacks due to their extensive patient records and interconnected systems. In 2023, Africa experienced an average of 1,987 cyber attacks per organization weekly. That's the highest globally. But there's an underreporting of incidents. Many cyber attacks go unreported, making it challenging to assess the full scope of the threat. This underreporting hampers efforts to develop comprehensive cybersecurity strategies. Cybercriminals are now targeting healthcare not just for data but also for leverage. When lives are on the line, hospitals feel immense pressure to pay. These aren't just IT incidents, they're clinical crises. They affect everything from newborn screenings to emergency surgeries. Behind each number is a story: a child waiting for a heart scan, a senior needing insulin dose adjustments, a nurse logging vital signs while systems crash. This is the human cost of a digital war, and why cybersecurity has become healthcare new frontline, and why cybersecurity has become healthcare's new frontline. Why does that matter? A cyber attack in healthcare isn't just a data breach, it's a health emergency. We've reached a point where nearly every aspect of care delivery depends on digital systems, from electronic health records and radiology imaging to e prescriptions and virtual care platforms. Our systems are no longer just supported by tech, they are built on it. When a system goes down, it's not just a software glitch, it's a clinical failure. Appointments are canceled or rescheduled, surgeries are postponed, and test results are delayed. Patients who need urgent follow up may fall through the cracks. Look at the 2021 ransomware attack on Scripps Health in San Diego, for example. The breach crippled access to all patient facing systems. Patient portals went dark, care teams reverted to paper records, leading to delays and confusion. 5 hospitals and dozens of outpatient clinics were affected. More than 150,000 patients had their data exposed. It took nearly a month to restore systems, costing over $100 million fully. However, large health systems are not the only ones at risk. Small practices, rural hospitals, and mental health providers are equally at risk and often less prepared. A 2022 Ponemon Institute study found that 70% of healthcare organizations had experienced significant operational disruptions due to cyber incidents, with nearly 30% reporting increased patient mortality. Let's take the case of Alabama, where a mother filed a wrongful death lawsuit after her baby died during a delivery at a hospital that was recovering from ransomware attack. The fetal heart monitoring system was offline, and the care team missed critical signs of distress. This is why cybersecurity is no longer just the IT department's concern. It's a patient safety issue. It affects continuity of care, provider workflow, legal risk, and public trust. Clinicians don't need to become cybersecurity experts, but must recognize that security failures are also clinical failures. What can be done? Well, to move forward, we must treat cybersecurity with the same seriousness and urgency as infection control or medication safety. We need to build a culture of security in healthcare that empowers every employee, from physicians to front desk staff. And here are 5 practical ways that we can use to get there. First, train staff at all levels. Everyone should understand the basics of phishing, password safety, and how to report suspicious activity. Nurses and receptionists shouldn't be expected to write code, but they should know that clicking a malicious link could lead to a system breach. Develop cyber breach response plans. That's number 2. Just like we do fire and infection control drills, we need playbooks for cyber incidents. How will staff continue operations if the EHR, electronic health records, is suddenly down? Where are the printed backup protocols? Who alerts patients and vendors? Number 3, harden your systems. That means encrypting sensitive data at rest and in transit, applying system updates quickly, using two-factor authentication, and reducing the number of devices with administrative privileges. Regular penetration testing and audits should be standard, not optional. Number 4, build leadership accountability. IT departments can carry the burden alone. Chief Information Security Officers should be part of the leadership team, report to the CEO, and not be buried under infrastructure teams. Clinicians should sit at the table when decisions about digital tools are made. And number 5, learn from other high risk industries. Aviation, finance, and nuclear energy have matured safety cultures that treat mistakes as system failures, not just individual ones. Healthcare must apply the same logic to cybersecurity events. Blame free reporting encourages transparency and improvement. Hospitals don't delay hand washing policies. Why delay digital hygiene? Both are about safety, prevention, and saving lives. So, in closing, cybersecurity isn't just a technical issue, it's a clinical one. And as technology reshapes our care systems, we all have a role to play in safeguarding them. Whether you're a nurse, a health IT specialist, policymaker, or a patient advocate, your voice and vigilance matter. If this episode gave you a new perspective on the human impact of cyber threats in healthcare, I encourage you to share it. Talk about it with your team, network, or local community health board. This is just the beginning. In future episodes, we'll explore how AI intersects with ethics, digital equity, and the future of health data. Until next time, stay informed, stay protected, and remain curious. Thank you.